Hi, I'm Dr. Suzanne Ellison, and I practice functional medicine in Comfort and Fredericksburg, Texas. And this is my first ever webinar, or actually it's a re-recording of the introduction to my first ever webinar because it was technically challenging. Anyway, the topic is how to lose fat in your arteries and know that you did, because cardiovascular prevention is really a favorite topic of mine. I hope you enjoy it. Today, what we are trying to accomplish is going over a great deal of information and concern for so many people. It took me a while to understand how to best assess cardiovascular risk, since we all have so much risk. The national average is that probably half of people will have that happening to them. And you can see that you're at the right place if you see those screens, and I would love to go over just from the very beginning what I mean by our risk. This is 2015 data, and the death from heart disease in the United States was over 630,000 people. You look down a ways and you'll see that the death from stroke was about 140,000 people. And here's the interesting thing. I mean, if I ask somebody, about that, and do they want to take better care of their blood vessels, then they might say, well, I mean, a heart attack is just fine with me. If I could just go that way, that'd be great. Maybe playing golf or with my favorite person on a trip that I want to take or something like that. As long as I'm up there in years, that'd be fine with me. However, what you can't predict for vascular issues is that whether it would be a stroke or whether it would be a heart attack. And so that being the case, that nobody wants to have a stroke, nobody wants to have any neurological degeneration at all, Alzheimer's, etc., Parkinson's, etc. Folks would like to remain relatively intact and die of a heart attack. But if you do the math there, vascular deaths are 643,000 and plus another 1,300. So 644,300 people, 744,300 people die of a vascular-related death. But did you know that there's over 750,000 strokes that do occur in the United States each year, which means that it's about neck and neck. You could have debilitating stroke, or you could die of a heart attack and stroke. And so it's sort of a coin flip, and it's one of those things where you might as well look into it as deeply as you can. And I began to get interested in that when as many of you know, I got very sick at age 50 and then got well using food. Subsequent to that, about a year later, I happened to be at a cardiovascular prevention conference, and I had my own CINT done. And when the result on that was that my arteries were older than I was and that I had some plaque visible, I got curious about what else to do about that. And I brought that modality into testing patients because truly that leading cause of death right there, there's another way to depict it on this slide. It's tailed off, it's sort of flattened, and cancer is catching up. That's what that actually shows. But men more than women die of heart disease, but women are catching up. And the best way to look at this and estimate this is to have some sort of a risk assessor. Great offerings of that can be found, for example, at the Mayo Clinic on their webpage. If you will just Google, just jot this down, Mayo Clinic Cardiovascular Risk Calculator, it will pop up with this screen, and then it's very easy to enter in the various things that they're looking at. It's complete. It's the way that actually 10 years ago, this kind of reminded me how we used to estimate risk. And your age, your gender, your height, weight, blood pressure, if you know your cholesterol numbers, those things will all go in. Whether or not you eat very many vegetables and fruits, or whether or not that you do much exercise, those things go in, and you'll come up with some sort of a number. And many of the in the current guidelines that the American Heart Association has set out say that individuals who are have some level of risk, and if it amounts to more than 7.5% chance in 10 years of dying, they should take statin medicines. The recent guidelines, the last set of guidelines actually posed that there was such a high risk, they felt, in the age group of 60 to 75-year-old men. It used to be recommendations were that about 45% were to take statins, but it jumped to 85% after those recommendations came out. And then in women, it went from about 27 to 55% of women. And so there was a huge number of increased at-risk people deemed worthy of trying the statin medication. And there was a lot of reaction to that in other communities. And this on the Mayo Clinic was an example of that. So use this calculator and see what you figure out about yourself at a later time. Here's a person who's a 64-year-old male, just inputting lots of data, 5'10", 200 pounds, with a normal blood pressure and actually a very low cholesterol at about 130 with an HDL of 30. And this person eats well, really, certainly more than the what's considered good. The number of vegetables and fruits a day is 5. And this person exercises maximally at least a lot of the time, he does. But you look at where his screening came in because he's 64 years old. So that, and this is on a more conservative risk assessor as well. The 10-year risk for him was 10.5% of having a heart attack, and it was suggested that if he could do some, mostly lose weight, that it would drop down to 7, and certainly that's his target. That's what he wanted to see happen. As you go through this webinar, you're going to see there's a lot of emphasis on a CIMT, and I want you to know that if you'll hang on to the end of the webinar, we're going to actually offer a free one to people, and we're going to go through a lot of detail over how to appreciate that particular test and other cardiovascular markers. And I want you to know that there's going to be a free one at the end. I also have a rather favorite supplement that I think everybody just about over page 55 should take, and that will also offer free one of those too at the end. I'd like to actually run a poll right now since a number of people are in the room, and what that would look like is simple 3 questions, and you're going to see them. The first one is, have you had a CIMT? And it's easy, yes or no, and if you all who are watching would go ahead and enter your answers. Excuse me, I got to hit publish. It's amazing how this technology is so easy. And right now it's 40, 67. I bet you all are able to see this as well. So it's about 2/3 have and 1/3 have not. Okay. And we'll take that, 70%, 30%. I'm going to end that poll. Thank you very much. And then we're going to run another one. And the question is, what do you think is the easiest thing you do that makes a difference in your health? And there's several questions there. What's the easiest thing? Exercise, diet change is coming through at 50-50. Nobody likes taking medication so far. Taking supplements, maybe a bunch of them, whoops, just shrunk down to 10%. And y'all are amazing. Nobody said that I don't like change, so none of the above is easy at all for me. But diet change is easiest so far, and exercise is harder. Supplements is also hard. Okay, let's go with one more question. This one is, would you like to win a CIMT for yourself or someone you love? or perhaps a favorite supplement of mine. Okay? Everybody would like to win. I think we're good. We're good with that. I'm looking forward to whoever wins that. Looking ahead, what this person was just a pretty perfect example to try to see if I could help him. And he was asking me questions. Well, is it the cholesterol that I eat? You probably know that eggs used to be very incriminated as that nobody should eat eggs, but I have occasionally run into somebody who said, my granddad lived to be 98 and ate 3 eggs a day plus bacon, and I'm going to do that too. So I was like, well, I'm listening. And sure enough, the amount of cholesterol that's actually in an egg, and you look at that actual quantity and you compare that to the amount of cholesterol that's actually in the human body, and it is so minute, the actual total amount that would add to what we ourselves are manufacturing. You'd have to do a lot more than eat eggs, in other words, to make an impact bacterially on your cholesterol. It's more complicated than cholesterol. Is it more than that? It's eggs plus. All of this stuff over here that's high carb and high, frankly, hard fats and dairy, that's a very high saturated fat quantity. And you're going to hear me say later that there is a real problem with saturated fat, truly, in some people, especially one subtype of their genetics that would have that suppress their, what they call endothelial progenitor cells. Those are the cells that help reline an artery that's got a nick in it. So yes, it's really more of a quantity of everything that we eat, and that happens to be my favorite kind of donut down there. I think that chocolate covered one. But is it pollution or heavy metals or anything like that? Is it? It probably is some of this, and the reason that we are having an upswing in this kind of death since about 1960 is because pollution has steadily increased since 1960. It's true of the use of sugar as well. There was a little bump in the 1900s when there was industrialized sugar availability in the amount of diabetes, but it wasn't nearly as significant as after there was a DDT came into existence and other airborne pollutions took effect. So there is something to this. So pollution has to ride around in our bodies somehow, and if it rides around in our bloodstream, dissolved into our LDL cholesterol, then it will cause damage just to that very thing, that very cholesterol. So just hearing that, I want you to understand that it's not as simple as it looks to just say that my cholesterol number is the problem. It's the first inkling that many of you know and have heard from me. So what does functional medicine approach to this cardiovascular prevention really have to offer? And I gleaned, over time, I was most interested after that CINT of mine was abnormal at age about 51. And I kept studying more and more about advanced cardiovascular markers and how to get a better grip on how to get those changed. And then that drew me into functional medicine because that is where that kind of interest lies right now, particularly. So what we're looking for is to diagnose things that are fixable sooner, because there are things that precede a heart attack and a stroke. There are markers, actually blood markers, that we can follow that show are we winning or losing in terms of efforts at prevention. Because functional medicine is really a systems biology approach which looks to truly individualized care. People who have plaque in their arteries come in with all kinds of gastrointestinal things, or they come in with autoimmune things. They come in with heavy metal exposures or other toxic chemicals, having worked hard out agriculture, and they'll come in with plaque, and it's probably somewhat related. Genetics is always there, we can't change that, but there are things we can work on. For example, disordered digestion leads to it. It's a root cause. Your digestion actually affects your hormones, your insulin and your leptin levels, and your disordered digestion actually affects your autoimmune system, causing more autoimmunity. And in addition, all of these things will eventually worsen mitochondrial function. And what are the lifestyle changes that make the most impact? And if you change any of these, everything else that's wrong with us usually begins to get better. And that's just a mystery, but we've got to go with it because it's just true. It's borne out in so many studies, but they are the usual preventive measures like sleep and exercise and diet and prayer and having that stronger spiritual connection with God, and then certainly supplements and medications that are necessary, and they are necessary. If something looks kind of scary, it's necessary. So back to this patient, what would I do with him? He wants hope that he doesn't have to immediately get on a statin. He says, I'd like a little bit deeper assessment, and can you show me something? Because even, 10% over 10 years, he's thinking, I've got a lot of time, and, I'll just exercise more, and tell me what else to do, and what can we look at? So I began to look at these carotid enema media thicknesses, and what you're seeing here, I'm going to show you several of these, so you'll get good at reading them, and you'll like, if you want to look at yours again, that I can help you do that. But this is the carotid bulb, and it occurs right about here in the neck. Every time that you try to feel your pulse, you're pretty much at the carotid bulb. It's a dilated area slightly. It's just a bulbous or dilated area right there at the top of, this is down towards the heart. This is up towards the brain. And this lining right there, which you cannot see very well because this is a very healthy CIMT, that means carotid intima media thickness. It's a very healthy CIMT. Those tiny little X's right there give us a measurement of 0.053 centimeters, which is 0.53 millimeters, which is very, very skinny endothelial lining. The other thing that's neat here is that there's a nice visible black stripe. And that black stripe right there is all muscle. And it's muscle that has not been invaded badly by cholesterol, so it stayed black. The outer dark white area is just what they call the adventitia, but it's just an outer area of the toughness. That's the toughness represented in any blood vessel. If you've ever been involved in cleaning a deer around here in Texas, you will have run into this, and that's the first thing that you saw in an artery. But this is terrifically open, wide open flow. Ultrasound signal comes from above. And this person first came to me about 5 years before this particular CIMT, and we found that he had arteries that were 30 years older, 35 years older than he was. And then he embarked on a program, and after about the 5th year of that program, his arteries are actually only 20 years older than he is, which means that he's gaining ground. And we know that that's actually a very positive thing. But in this example, you can see there's a lot of blurring of that picture right up here, and that means that the ultrasound picture has come through and has hit calcium and it's gotten dispersed, so you can't read it. But the bottom layer, because it's on the other side of fluid, and with ultrasound, you can read that. And you can see that measurement is about 1.19 millimeters. And so, yes, it is. It's 1.19 millimeters. So that is quite a bit older artery, even though he was probably about 58 at that time. This was a pretty shocking piece of plaque right here. Plaque is a real irregular, usually surfaced glob of fat. And it, again, I can see some up here, but I can't measure it. Here we at least have a measurement of 2.79 millimeters. And any plaque at all means that you have the disease. You have, arteriosclerosis, you have risk for heart attack and stroke, and peripheral vascular disease as well. This is a cutaway version of the transverse, in other words, not the longitudinal. This one is going straight up, looking towards the brain. And in this one, the outer artery wall is right out here, and in here there is this half moon looking thing. That whole thing is plaque. The distance on that is 2.12 millimeters, and that is our guess, this distance to this distance. And what we do with this is send these people for further ultrasound to make sure that they've not got severe obstruction anywhere along that track. This is a sample of someone who was a young person who had actually lost in 2 different years about 30 pounds. And they had a concern that they, at age 22 or 21, approximately 22, that they had been not living well and that they'd eaten way overeaten, and then they wanted to turn that around. And so because of cardiovascular history in the family, that person measured out as an artery of about 44 years old. And 44 years old at 22, that got his attention. 1 year later, in 2012, he'd lost 25 pounds and run a marathon, and he'd gotten his arteries down to being about a 33-year-old artery, 30-year-old aged artery, and you can see how those things are plotted out. These are population norms down here for ages, and this is a width of that artery measurement right here. So regaining 10 years of life in that 1 year effort, that was pretty awesome. And it happens to us older people too, that we can regain that as well after I addressed that issue in my own arteries. In fact, my arteries, I gained 2 years of age and my arteries stayed exactly the same. So I too was catching up with the age of my arteries. And so I get excited when I see this kind of thing. Patients love it. This happens to be somebody who walked in, a very, very healthy woman at age 61, and I was surprised she had high blood pressure. It was just a shock. She was the picture of health, incredibly good diet, and such an exerciser. And what we're seeing here is two branches. This one is going up to the inside of the brain, and this one is going externally towards the ear. But that is a great big piece of plaque. What's interesting about this plaque is that there is a calcification across the top. And we'll come back to that a little bit. When we measure CIMT, that is the segment that we're actually looking at. It's just before the bulb. And so that's the main technical issue, is first the ultrasonographer has to find that segment and get it well visualized, and then this is that same person with that plaque. Her arteries were that of probably 20 years younger than she was. The LP relay problem simply means that there is actually a factor that can attach or is inborn genetically attached to your LDL cholesterol that causes that LDL to drive bottom worse, and so the buildup can be worse, and plaque-related events are much more common. This is a similar calcified, narrowed interior looking upstream. So that's lots for you to see. This one is one of the scariest plaques I've ever seen. That is actually a plaque that is not calcified, and it's relatively young, meaning that is all fat in there. And that is more of a dangerous plaque because it's very soft. And then let's talk about the dynamics of what happens. And it's complicated, so I'm just not going to, I will certainly make it understandable, but it's going to be a bit complicated. What makes plaque happen? This is a person who's got typically a cholesterol level of 100. And that LDL cholesterol level of 100, you know, if you've got a report like that, the doctor would say something like, that's pretty good, that's not so bad, from what we know. But if you do a separate kind of testing and look for what's called small dense LDL, or if you just look at particle number, LDL particle number, those are two of the markers that I commonly do, you'll find some people with a whole lot more particles involved to actually make up an overall LDL number of 100. Elevated blood pressure can drive that kind of smaller particle between those little endothelial cells lining the CIMT that we were looking at. That lining is supposedly about as thick as a piece of Kleenex, and so it's very easy to drive those particles in between the cells. Inflammation makes that endothelium a whole lot more porous and permeable. In between the cracks, those smaller particles are happy to squeeze in. Whenever LDL gets out of the way, it by itself gets more oxidized and harder, and glycated means that sugars get attached to it. People who've got higher blood sugars that are pre-diabetic or diabetic, they have to worry about what has been a driving force for the buildup of LDL in the arteries. And then after that buildup happens and they become even angrier particles than they were, foam cells, which are simply white blood cells, have invaded the area and that they have started to gobble them up. And what happens with that is that this, remember I showed you a picture of that CMT and I said that one person had a really pretty black stripe? Well, that's that red muscle stripe right there. And so that's a very normal, good-looking artery right there with a very thin endothelial lining, which is one cell thick. And then as the little LDL particles get shoved into underneath, they just bouncing around and they head in there, they'll develop an accumulation that thickens and thickens until now you can see that at this point it's twice normal. At this point it's probably 4 or 5 times normal. And so as we age, this is the progression. And so much of what we saw on that screen before, the screens before, was in this area or this area. And when I was worried about that one soft plaque person, it was in this area here. More towards the middle where it says fibrous cap. There's just a word you can barely see. And so I'm thinking that once the foam cells are formed, there's more discernible inflammation that's coming out of them that we can actually measure, CRP and LPPLA2, and that oxidized SDL goes ahead and causes even more endothelial dysfunction. And then there are fewer covering cells, those endothelial progenitor cells being created, and so the plaque becomes more tenuous. There are other factors named there, TMAO and homocysteine and other toxins. They all aggravate it and they increase what's essentially an immune response, because the oxidized LDL provokes an immune response. They now know that. And so antibodies get involved and the white blood cells are more than happy to go ahead and do whatever they know to do. They just do their usual, which is that they go ahead and they attack that oxidized LDL. And when we're talking in that area, we're getting more scared, and that there is you can see there's an area in here where there is an erosion or a deposition of actually mushiness that's more fragile. And their calcification can actually form in that muscle cell, the muscle cells along the way, and that's how calcification of the arteries does happen. If it happens super slowly, then just the blood pressure goes up, and maybe it takes forever to have any kind of event. But as the cells die, what happens is calcium leaks out into the cells, and there are more and more opportunities for that muscle to get ruined. The plaque itself starts to crystallize, and you remember we saw some very white plaque? And then there comes in a protein called matrix GLA protein, and it tries to get rid of that calcium, but it can't always remove it by far, especially if we're short on vitamin K. That's a hint as to what my favorite supplement is to kind of stabilize both bone and arteries. So moving forward, you can see that we're coming into a place where there's actually a break in the fibrous cap, and then there's an attempt to plug it with something that is clot-like, very much clot-like, almost as though you would think it needs a scab, and then what happens is clot fills the actual opening, especially if an erosion happens, and I'm going to mention a chemical called myeloperoxidase, which foments that erosion. So coagulation happens on top of a broken plaque, and that's what a heart attack is, that's what a stroke is, even if it's in small blood vessels. And that 75%, anywhere from 60 to 75% of all events, heart attack and stroke, are from this process. So, what do? Advanced cardiovascular markers exist, and they are of inflammation to find the process before it's gotten so bad, and of metabolism as well. I had a patient come in who said, my cardiologist says that I have just slipped through the cracks, and I've had a bypass, and I've had 2 stents in the bypass arteries, and he didn't tell me to go home to die. He told me that if I got into trouble again, and if I could get to them soon enough with chest pain again, like I always had, that they'd be able to help me again. And he thought, I just wish there was more that we could do. So we began to look at it. He was on maximal statins, and his doses, his cholesterol levels were low, looked like it ought to work, but it wasn't working. So we began to look at these other markers, and every one of them was abnormal. There's many things that I take care of at that point and look and see if it's more of an urgent situation. So yes, he went on a lot of supplements to try to fix every one of these. If you screenshot this, these are the kind of testings that some of them are very common. Homocysteine is common, insulin levels, certainly any physician will order that, vitamin D levels, and they may even order your omega-3 and omega-6 ratio. These are more specific to the deterioration of plaque, these three. This ApoB, ApoA1 is a very good marker of the particles that are dragging bottom, basically, because ApoB is a better reflection of what the particle number is than is LDL cholesterol. So what can you do today, though, to just really drop your risk 20 to 30% each? And you might think it's about what do you eat, and what do you do with your feet, and what do you feel is incomplete, or what do you do to feel complete? All those things, maybe it's an addiction, maybe it's something that you feel is incredible stress and pressure, but actually it's start easy. Adopt a cat. It's been shown that having animals, cats too, lowers cardiovascular event risk by 20 to 30%. Same with eating 2 handfuls of nuts a day. Almonds have the highest protein. I like pistachios better, so whatever is your pleasure there, but you have to limit it simply probably on a calorie standpoint. Eating dark chocolate, a couple of squares a day, has a tremendous amount of polyphenols in there. It's one of the strongest antioxidants that we can eat, and at least a 72% cacao is needed. Consumer Labs has a nice critique on how they all taste. consumerlabs.com. And then, it looks like the audio's out. I'm not happy about that. Is the audio in or out? Okay. When, you have to decide what you're going to eat and what kind of plan you'll follow. And for example, if you're quite a bit older, it doesn't hurt to add more fat. 2 ounces of nuts a day, many more plant servings. They say if you'll do over 5, that's a big help, but I think doing 9 at the point where if you have any of those CIMTs that we just saw, it helps to do a great many more than that. Reducing grains, and it's not just about the carbs, it's about the problem with lectins, which tend to penetrate and perpetuate autoimmunity in the gut. And then the use of intermittent fasting, which is a 12 to 14 hour gap between supper and breakfast. Most days, 4+ days, 5 days a week. And then one day, and this is harder, but it's a 24-hour supper fast. That actually helps us remodel our body. It's a process called autophagy. And that means that our body when it needs to make new cells, it's got to use some substrate. And if we're not eating, then it's going to go ahead and take out the cells that have been maybe clinging to life and wanting to be replaced. If somebody would just, goose them, then that's kind of how the body works, is that it takes apart mitochondria that have been dismantled and makes a new one. And the more that we go ahead and implement a number of lifestyle strategies, the healthier our cells that are next made will be. If you'll just eat more intentionally, sometimes that does the trick. Eating more slowly, chewing. Amazing that you have to chew 32 times per mouthful to really get all the nutrition out of it. If you've got a nagging digestion problem, I would like you to write this down and take a look at this webpage. Not very visible there, but it's gundrymd.com. If you have issues with digestion, and you're quite sure you do, bloating or constipation, or worse than that, any issue at all, he has got a supplement that is called Restore, or I'm blocking on the full name, but Total Restore. And that supplement can begin to get your gut healthier, and that's the first step. If you eat out less and cook more, many times John and I will go ahead and take a Sunbasket box at home, and it will have 3 of the meals just ready to be pulled out and made, and all the directions, and it's really been a lot of fun. And I don't know about you, but after 5 kids, my cooking at home had gotten pretty routine, even kind of stale, and I'm delighted to I'm being taught again how to cook more things. And even if just temporarily doing that would boost your interest in cooking at home, that would be well worth it. That would be sunbasket.com. What you do with your feet, there's a way of exercising that I truly advocate because it's been so helpful for endothelial lining improvements. It's called high intensity interval training. Many of you probably heard of it. You can start very small with absolutely anything that you can do, alternating fast and slow. That could be boxing motions, or it could be walking in place really fast with a 1 pound weight. It could be absolutely anything. It could be swimming. It could be stair stepping. But you only need to do 4 minutes, alternating 20 seconds fast and 10 seconds slow, and working on up to maybe 12 and 18 minutes. That particular phenomenon increases the ability of your own arteries to dilate under stress. 2 days of strength training to start, and just don't hurt yourself. Take it easy and don't hurt yourself. And then, stress is this silent killer. It's really hard to quantify. If the more that we put our life into God's hands, we find more time for all these pesky preventive details. I just have to say that's the only way that I can do it myself, because it takes an hour or 2 a day sometimes to get enough prevention involved at the age that I am. So, process disappointments with somebody that wants to talk, wants to listen for a long time. Grow your spiritual life. And so, if you'd like a CIMT, this screen has our telephone number, it has Tracy's email address. And the CIMTs are done at Cornerstone Clinic, which you all may know, and the report can go to whichever provider you need it to go to. And that cost is just $100. And if you'd like a follow-up with me to go over that with cardiovascular risk testing and labs, anything that we would have deemed necessary after first glimpsing your CIMT, then that cost of the half-hour visit to review everything is just an additional $150. And if I were going to suggest one supplement, this would be it. Megaquinone K27. At a dose of greater than 300 micrograms per day, it helps with cardiovascular prevention by helping calcium, keeping it out of your arteries and in your bones. Studies show also that there are lower cancer rates and osteoporosis with adequate doses. So it's the best product that I have seen for vitamin K2 and K7, and that cost is just $32.75, and you can contact Tracy with regard to that as well. We are going to select amongst the members here, and technically, I have to apologize, I'm not sure that unless Tracy's figured it out, we're going to be able to pick up the names from, if everybody who has arrived in this would chat in the chat box, we would know for sure that you are here. I am looking through it and I see a lot of people, but if you have not entered a chat, you can just send us your name in that chat screen and we will hang on to your name. And we will definitely give away a CIMT to one of you. We'll put your names in a hat and we will draw one out and we'll send somebody else some Megaquinone, who's the lucky winner of that as well. At this point, while y'all are just doing that and just filling your names into that so that we see your good. I love it to see that you are there. Go ahead and we will be sending that out by email later as to who won that. The thing that I want to show you is simply a screen now that can link you to an offer, just to make it plain. that you can choose either CIMT alone, if you'd like to sign up for that. I can only do about 16 in the next reasonable period of time, about the next 6 weeks. So if you're interested in that and you'd like to sign up for that, that would be great. And if you'd like, the second offer that I'm going to post is a CIMT and a follow-up with me. And so what I would say is thank you so much for attending this webinar, and it's been a pleasure to work it up. You probably can tell I love studying, and so it gave me yet another chance to do that again. And I appreciate all of you for the interest that you have in your ongoing health, because of the people that means that you love and care about. Perhaps most of all, just hoping that your body will take you the distance that you'd like it to go. And I'm going to leave the offers on the screen for just a little bit longer. And I'm going to just say goodbye and thank you so much for coming. If we have any questions though now, if you'd like to hang around, and we will look at those.
She wants to know if you will do something similar to Sunbasket.
I'm sorry?
She wants to know if you will do something similar to the Sunbasket program.
Well, honestly, we were asked if we're planning to produce food. And Sunbasket is an interesting phenomenon. You actually have to want to cook still. And I'm game for that. I love learning what they're teaching me. So I'm not interested right now in developing that, but we have developed a program called Food for Thought, where food is actually being made at the Haven River Inn for people who are not interested in cooking. It's incredibly nutrient dense, and it is especially designed if people are worried about cognitive decline. And it's delicious because the chef there just doesn't know how to do anything except for delicious. Okay, I am going to close this webinar now, and I just don't see any questions, so I'll just figure that I was complete enough to be heard.